So what we're looking at today is the use of Align RT for head and neck radiotherapy. So in terms of the application of SGRT or Align RT with the head and neck region, so I think from your clinical experience, you will know that the main thing that we're looking for in this area particularly is how can we mobilize our patients well? How do we get a reproducible setup? And how do we get patients to maintain that position throughout the treatment delivery? So we know we've got critical structures or organs at risk within the head and neck region. So we want to ensure that we maintain the safety component as well as improve the patient comfort. So I think that's sort of the challenge or the trade-off that we have within the head and neck region particularly. So what we're looking at here is Align RT is used for almost all anatomical sites, but we are seeing a trend that customers are moving towards sort of maskless or sort of less invasive immobilization solutions. So what we're going to show here today is specifically the use of head and neck maskless radiotherapy, which is supported by the Macromedics DSPS prominent shell. So basically what we have here is a posterior or occipital shell only that ensures we have a custom created mask for the patient that molds nicely to the neck and sort of supports the shoulders as well. So what we can see here that the mask is custom made. It's molded against the back of the neck, and we've got the shoulders supported and exposed. So again, we want to ensure that the patient maintains a neutral head position. That will allow us to have full visibility of the regions of interest on the face as well as the shoulder area. So if you think of the traditional approach, we had the closed mask, which meant that the face as well as the shoulder area was hidden beneath the mask. And I think I'll hand over to Josh at the end of the demonstration is we have seen that even though patients are immobilized within the thermoplastic mask, there's still movement within the mask. And I think it's sort of quite an astonishing number, and Josh will speak to this as well, that at least 40% of patients from the data set that they looked at had intrafractional discrepancies and movement within the mask. Just from clinical experience, we know that we take a CBCT and we think that the patient is in a good position and the shoulder's not quite aligned. The chin's not quite in the correct position. So once you've done the CBCT, it's not uncommon to say, could you pick your chin up a little? Could you drop your chin down a little? And now we have that entire chest, thorax, upper thorax, and face area exposed. So just to look at how Align RT plays a role in this entire process. So we said during the simulation, we've got the custom posterior shell. The head is in a comfortable position that the patient can maintain throughout the treatment session. And in terms of the data within Align RT, we have the body contour of the head and neck region. We have the regions of interest defined over the face, the neck, and the shoulder area. So these are focused or areas of interest. So if you look up at the Align RT screen here, we have a larger region of interest, including the face, the lateral components of the neck and the chin, as well as the sort of clavicular area. So within the Align RT system, it's possible to have multiple regions of interest, and it's also possible to use tools within the software to support that positioning and that initial alignment. So if we switch over to the video mode, so as part of the preparation, we've prepared some regions of interest over the face and the shoulders. And a nice feature within Align RT, so Irakli has just pointed through to those regions of interest. We've got multiple regions of interest within the software, and we can easily flip between them during the treatment setup process. So what I'm going to start with at the moment is the video mode, and what postural video mode allows within Align RT is to easily set up our patient with some visual guidance. So you can see that we have the pink outlines, which is representative of the ideal position, and this is automatically defined or outlined on the DICOM RT structure set. So within the software, the initial DICOM CT has the pink outlines indicating the ideal position. So here we see the edges of the patient nicely outlined, and that gives me a visual indicator of how do I need to adjust the head or the shoulders to get into the ideal position. So like we said within the mask, one of the challenges was how do we know that the patient is well positioned within the mask? Now we have this entire area exposed. Align RT is doing a point-to-point match within that entire area to give us the deviation from the ideal position as well as visual guidance. So for example, how do I correct the rotational errors? So you can see that Align RT is very sensitive to detecting rotational discrepancies. And at the moment, we are on the face ROI. So if we look at the surface view, you can see that the ROI incorporates the stable anatomy. So we have all of this T-zone and the cheeks, which is a good indicator of rotational discrepancies in the head. So if you tuck your chin down for me a little, you can see that that corresponds very well to the pitch. And if you pick your chin up a little, so I have both the numbers, the quantitative or the absolute value, and we have the visual outline of the postural video to guide you during the initial alignment. So I can do the same for the shoulders. So you can see here, if one of the shoulders is sort of lower, if you drop down that shoulder for me. So you can see here that there's a gap between the ideal position and where the shoulder is right now. So if you push up your shoulder just a little, there we go. So basically the mask is nicely molded to the back of the shoulders, as well as the visual outlines here, which are guiding us to get those shoulders into the right position, to get the chin nicely aligned, as well as this rotational corrections up front. So like we mentioned, one of the challenges is CBCTing, identifying the rotational correction, asking the patient to compensate for that, and then repeat the CBCT. So what we're doing with Align RT is that we're avoiding that repeat imaging by getting an accurate alignment pre-CBCT. So I've corrected all of the rotational information using the postural video over the face and the shoulders. I can check between the regions of interest. So if we flip over to the shoulders, and if we look at the deformation view, so I spoke to you about the postural video outline. Align RT has another feature which is called deformation. And what deformation is doing, it's a point-to-point correlation within the defined region of interest. And it gives us a nice visual indicator of how do we need to correct the body or how do we need to correct the posture to get the patient in the right position. So here you can see that the left shoulder is slightly higher. So here over this region, if you relax the shoulder ever so slightly, so you can see that areas that are red are above. So for example, if I saw a lot of red on one side and blue on the other side, it means that the patient is rolled. So I can use the visual guidance to understand how do I need to correct the patient. So if we switch over to the face ROI as well, again here you will see that all of the area within the face is green because there's a really good alignment or match. If you tuck down your chin ever so slightly, you will see that there's areas of blue because it's below the ideal position. You can see on the pitch as well that there's a pitch. So if you pick up your chin ever so slightly, and there we go. So we're getting a really fine-tuned alignment of the patient pre-CBCT, rotational and translational corrections to avoid any repeat or additional imaging once we've done that image registration. So there's tools within Align RT to help you quickly and effectively position the patient, and as well as monitor that region of interest throughout the treatment delivery. So looking at the typical workflow, we've nicely aligned our patient in all 6 degrees of freedom. We will now proceed with the CBCT, and what we expect to have here is a really good correspondence between your image registration, because we've corrected the patient position, with postural video, deformation, and we've ensured that we are well within the thresholds. So if we look at a head and neck region, these protocols or these threshold values are customizable. We have 2 sites at the moment that are using the Macromedics mask as well as Align RT, and one is full, and Josh will speak about the study and their early findings. The other is Le Havre from France, and one site has 1.5 millimeter thresholds on the translations and 1.5 degrees on the rotations. At 4, we're using the default of 2 millimeters and 2 degrees. And so here we're using these thresholds for the initial alignment as well as the intrafraction motion component. So once we've taken the CBCT and we are satisfied with the results of the internal match, we're going to then go ahead and take a reference capture, and this forms our new baseline for that particular session or fraction. So if we take a reference capture, so what we've done at this point is we've taken a new reference post CBCT, and we have a new 0, 0 position or a new baseline for that particular fraction. What we have seen from the early patient data is that because the patients are comfortable, they have the neck and the head nicely supported, patients maintain this position throughout the treatment session. Because I think sort of the concern is what happens when we remove immobilization? Does that create room or area for the patient to move as they please? And it's actually the contrary that we're seeing, that the patients are quite comfortable and that they're maintaining that position throughout the treatment session. So here you can see that the region of interest is nicely propagated over onto the new surface. It's user defined, so we can remove the area over the eyes when the patient is following the gantry, when they're blinking, if they have very long eyelashes. So these regions of interest are quite customizable. So if we look at the monitoring component, we are interfaced with the LINAC. So irrespective of the LINAC, if it's Varian or Electa, we fully integrated for the automatic beam hold. So whilst monitoring, dependent on the selected ROI, we are interfaced with the LINAC and the beam is enabled. The moment the patient moves away from that ideal position, if it exceeds the defined threshold, the beam is interrupted automatically.